Hi everyone and welcome back to my YouTube channel. Today we will be taking a deep dive into the world of pregnancy, but not the fun part. We will be looking at the factors relating to a condition called Hyperemesis Gravidarum, which I'll sometimes refer to as HG for short. Hyperemesis gravidarum typically affects women in the first trimester of pregnancy. Many of the symptoms are similar to those of morning sickness, however, the symptoms are exacerbated. These symptoms include severe nausea, vomiting, dehydration, intense weight loss, nutritional disorders, and/or constipation. Morning sickness tends to subside in the second trimester, but hyperemesis sometimes occurs until parturition. There have also been cases of women who continue to experience their symptoms even after giving birth. If left untreated, hyperemesis gravidarum can lead to severe consequences for the maternal and fetal party involved. Nausea and vomiting of pregnancy is generally estimated to occur in 50 to 90% of all pregnancies, and the incidence of hyperemesis gravidarum ranges between 0.3 to 3%, although it averages to affect about 0.5% of all pregnancies. In a study published by the Scandinavian Journal of Public Health on the prevalence of hyperemesis gravidarum in Norway, they found that women born in India, Sri Lanka, and most African countries had the highest prevalence compared to those born in Norway or other countries. The reason behind this is unknown, and the researchers highlight the need for future analysis of the matter. The effects of migration on the individual and the family, as well as the difference in ethnic diets, have been suggested as possible factors. Although the exact cause of hyperemesis gravidarum is unknown, researchers have shown associations between a number of risk factors and the condition, some of which are listed here. Researchers have found an increased risk in women who were under 30 compared to those who are older, contrary to many other pregnancy issues. These women had a higher rate of HG hospital admission. It has been found that women located in Asian and African countries have a higher incidence rate than other geographical regions, as mentioned before, although the reasons remain unknown. A study done showed that women hospitalized for hyperemesis gravidarum had a 50% increased chance of having a female infant, and women who were hospitalized for more than 3 days had an 80% increased chance. This study was done on 11,893 women. A smaller study found very similar results, as well as indicating that a female fetus may be a risk factor for HG. Another study found the recurrence rate of hyperemesis gravidarum was high, and this study also found that many women changed their plans because of this. Some of the women who originally wanted more children stated they no longer wanted to get pregnant because of their experience with HG. A matched pair study in pregnant Chinese women found that thyroid-stimulating hormone, or TSH, and free thyroxine hormone, or T4, were found in higher levels in women presenting with HG. Beta-human chorionic gonadotropin hormones effects come with conflicting research. The matched pair study found that HCG was not a significant determinant. However, other researchers have found an association with increased levels of the hormone and its subunits in hyperemesis patients. Helicobacter pylori is a bacterium that causes gastrointestinal tract issues in its infected host. There are mixed results in the research for the association between this infection and HG. However, most research has found an increased risk for hyperemesis gravidarum for those who previously infected with Helicobacter pylori. It is mainly linked to the severe forms of the condition. Other hormones, nutritional deficiencies, or psychosomatic causes have also been researched, but again, no clear cause has been isolated. After diagnosis by a physical exam from the physician, many different treatments to the symptoms will be presented. Antiemetics are pharmacological drugs that inhibit vomiting and are typically provided intravenously. However, they typically come with side effects such as drowsiness, dizziness, and dystonia or muscular spasm. Electrolytes are also provided intravenously to combat the dehydration that accompanies the condition and the constant vomiting. It has also been found that preemptive dosing may prevent symptoms from occurring at all, which can be applied to women who experience hyperemesis gravidarum in their first pregnancy. Researchers have also noted the effectiveness of hydrocortisone treatment, which is a steroid that the placenta inactivates. However, there has been some contradicting research questioning the safety of this treatment, as some studies show an increased risk for fetal oral facial clefts, while others have found the risk to be at baseline levels. A retrospective study of a 10-year cohort of women who were hospitalized for HG found that patients treated with enteral feeding methods were able to gain weight they had lost and therefore decreasing their risk for malnutrition. However, some studies have found this to increase the risk for preterm labor and side effects that accompany tube feeding, such as tube expulsions. Enteral feeding is typically only provided for women who are experiencing extreme forms of the symptom and weight loss. In more mild cases, lifestyle and diet modifications have been shown in research to be effective. This includes eating smaller, frequent meals and avoiding food with potent odors. It is not hard to understand why HG leads to dehydration and electrolyte imbalance, because the main characteristic is uncontrollable vomiting. What does this mean for the mother? Well, if allowed to fester, dehydration can lead to severe damage to the kidneys, central nervous system, and other vital organs. Prolonged periods of vomiting can lead to hypokalemia and hypomagnesemia in the patient, which again is an electrolyte imbalance. This state can trigger ventricular tachycardia, which, if untreated, can lead to unconsciousness, heart failure, and cardiac arrest. Another maternal complication is the increased risk for preeclampsia that was found in women who were first admitted into the hospital in the second trimester. Preeclampsia can lead to high blood pressure, seizures, and impact the liver function. However, the same study found that the risk did not increase for women admitted in their first trimester. Many studies look at the association between hyperemesis gravidarum and the maternal cancer risk. Scandinavian researchers found a link between an increased risk for thyroid cancer for women who experienced HG in pregnancy. However, it also found an inverse link to cancers in other organs, such as the respiratory system. It is unclear if this is related to the condition itself or lifestyle factors of the patients. There are also results that contradict each other in relation to the risk of breast cancer in this population. These maternal implications in relation to cancer, although continuously studied, are purely correlational. As mentioned, for maternal implications, preeclampsia as well as other placental dysfunction disorders have been linked to hyperemesis gravidarum. Not only do these conditions impact the mother, but they also impact the fetus, as the blood flow carrying nutrients and oxygen is often restricted. Now, what does that mean for the developing fetus? This can lead to improper development of the central nervous system, leading to developmental delays and malformations. Depending on the severity, this can be life-threatening for the fetus. Reduced blood flow also leads to intrauterine growth restriction because of the lack of adequate nutrients. Many studies have linked HG to newborns who are small for gestational age. A study looking at the offspring of mothers who were admitted to the hospital for hyperemesis gravidarum symptoms found that these children typically have a lower sensitivity to insulin. Consequently, these children have a higher risk of developing diabetes mellitus and cardiovascular disease. However, the study did not analyze the mechanism behind this or why this occurred. Some studies also highlight the relationship between preterm birth, with some researchers indicating that there is an increased risk for preterm birth for HG patients. However, many studies highlight the opposite or find no statistical difference for the time spent in gestation between control patients and HG patients. It is also important to recognize that when symptoms are managed, the risk for improper delivery or formation of the fetus remains low. The research in current management options identifies many treatment options. However, the gaps in these studies are detrimental, as many of them are linked with side effects and have contradicting research. Steroid treatment seems to be a promising treatment, but further research is required to implement it as a first-line treatment. Lastly, the implications for both the mother and fetus have been highlighted. However, studies in relation to the risk of cancer and preterm birth may be aided by bigger and more thorough experiments. I hope you learned about the complex condition of hyperemesis gravidarum during this video.